We're tackling a critical topic for your phlebotomy exam, the order of draw for blood cultures. The single most important rule to remember is that blood culture bottles are always drawn first. This isn't just a recommendation, it's a strict protocol designed to prevent microbial contamination. The exam will test your understanding of why this rule exists. Imagine this scenario. You draw the lavender top tube before the blood culture. The non-sterile stopper of that lavender tube can introduce bacteria onto the needle that then gets transferred into the sterile blood culture media, leading to a false positive result. A false positive can have serious consequences, including unnecessary antibiotic treatment for the patient. Therefore, the sterile specimen is always collected before any non-sterile additive-containing tubes. This includes drawing it before the light blue top tube for coagulation studies. An exam question might list a series of required tubes, including blood cultures, and ask you to identify the correct collection sequence. Always select the option that places the blood culture collection first. A common exam trap is to present a scenario where a light blue coagulation tube is ordered stat. Even in this situation, the blood culture must be drawn first to maintain the sterility and integrity of the sample. Remember this simple phrase, sterile before systems. This means the sterile culture bottles come before all other tube systems, regardless of color or priority. After collection, gently invert the bottles 5 to 8 times to mix the blood with the culture medium. Do not shake them vigorously, as this can damage the red blood cells and interfere with the results. The exam may also test your knowledge of sample volume. The volume of blood collected is one of the most important variables in detecting a bloodstream infection. An insufficient sample size can lead to a false negative result because there may not be enough bacteria present in the small volume to be detected. For adult patients, a typical draw is 8 to 10 milliliters of blood per bottle. A question could describe a situation where a phlebotomist only collects 2 milliliters for an adult culture and ask for the most likely outcome, which would be a false negative. Finally, be aware of pediatric collections. For young children, a single aerobic bottle is often used, and the required blood volume is much smaller, sometimes as little as 1 milliliter, based on the child's weight. The exam could present a pediatric scenario to test if you know this exception to the standard 2-bottle adult collection. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.